In today's video we are going to talk about brain zaps and antidepressants. Brain zaps are electrical shock sensations in the brain. They can happen in a person who is decreasing or stopping their use of certain medications, particularly antidepressants. Brain zaps are not harmful and will not damage the brain. However, they can be bothersome, disorienting, and disruptive to sleep. People may be able to minimize or prevent brain zaps by tapering off their dosage of antidepressants gradually. However, a person should always work with a doctor before stopping their medication or lowering the dosage. Abruptly stopping an antidepressant may make a person more likely to experience brain zaps and other symptoms. There is no cure for brain zaps, and they usually go away over time. Once a person's body has adjusted to the change in antidepressant dosage, brain zaps and some other side effects may decrease. Causes of brain zaps. Researchers have linked the following drugs to brain zaps. Antidepressants, including selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors. Benzodiazepines, which are common anxiety medications. Amphetamine salts, Adderall, which doctors use to ease the effects of attention deficit hyperactivity disorder. Ecstasy, or MDMA, which is an illegal drug. Health professionals do not know exactly what causes brain zaps. They are one of many different side effects a person may experience as they change their dosage or stop taking a drug altogether. Brain zaps and other symptoms of antidepressant syndrome are common. In fact, a systematic review and meta-analysis found that more than half of people who attempt to decrease their dosage or stop taking antidepressants altogether experience symptoms of withdrawal. Some other symptoms of antidepressant syndrome may include changes in sleep, anxiety, headaches, difficulty with emotions, nausea, fatigue, flu-like symptoms, visual changes, confusion, tremors. Not everyone will experience these symptoms, however. In many people who do experience them, they may last only a few weeks, according to a systematic review. People should always work with a doctor if they wish to lower their antidepressant dosage or stop taking the drug. Treatment of brain zaps. The best way to minimize or prevent brain zaps is to gradually taper off medications rather than stopping them abruptly. However, some evidence has found that tapering does not guarantee that a person will not experience brain zaps or other symptoms of withdrawal. That said, it can make it easier to cope with the change. Experts recommend a gradual taper of antidepressants to minimize withdrawal symptoms and ensure that a person maintains good mental health as they stop taking the medication. Some evidence suggests that undergoing cognitive behavioral therapy, CBT, while tapering off medication may also be helpful. Thank you for watching this video from Health Educator. Don't forget to click on the subscribe button.